And when you're talking, folks will see you. Can we do a little sound check, Evan?
Hello, hello, hello. Good morning / good afternoon.
All right.
Live from the internets.
It's all happening. So because Evan is a technical guru and because my computer decided to update at the last minute, Evan is helping us out with our technical issues today. So Evan, I'm going to actually try to set us up on my computer so I can better navigate this conversation. I'm definitely going to read your bio to everyone, but maybe you can tell us a little bit about yourself while I'm setting this up.
Sure, folks. So you all can refer to me as Evan because that is my name. My name's Evan Pastor. I grew up on the East Coast, but for the last 5 years or so, longer than that now. Wow, time flies. Well, for a whole bunch more years than 4, I've been living in Oregon. Originally came out here to actually kind of disconnect from the work that I had been doing, which was union organizing in hotels and restaurants for about 15 years, or actually about 12 years at that point. Ended up living on a small farm with illusions of grandeur, growing broccoli and other stuff, and somehow got right back to what I was doing previously. So right now, I am the person at our union who bargains contracts. So I work for an organization called SEIU, Service Employees International Union. We have, similar to a congregation, we have membership. It's all voluntary. We have 78,000 members, I want to say, at this point in Oregon, with a constituency that is all over the map, but filled with essential workers everywhere. From nursing home employees, which I'm very familiar, to hospital employees. There are police in our union. There are also effectively the welfare department. So it's a little bit about me, what I do.
All right. And I'm going to tell you a little bit more about Evan. So as he alluded to, he is an expert in labor relations and healthcare negotiations, representing thousands of public and private sector employees across the country. And since the start of the pandemic, Evan has represented 4,000 nursing home employees as they struggle to keep themselves, their families, and the nursing home residents safe from COVID-19. As a former Florida resident whose mom is regularly tested for COVID-19 at a Florida nursing home, Evan is intimately familiar with the challenge of caring for loved ones at this time, as well as the national crisis facing our seniors. So we're so grateful to have you here today, Evan. And I'm wondering if you could go into a little bit of detail of what that struggle is for nursing home employees right now.
Sure. And interrupt me continuously at all times. I could talk about this topic forever because it's close to my heart. So, the problem with talking about this conversation is it is kind of a downer, as we are in a national pandemic, right? At this point, I think the latest number I saw is that we're at 233,000 Americans dead since last March. Florida's been one of the worst hit states in the country. What many folks miss in that number is 80,000 of the 233,000 folks who have passed from this are seniors. There are moms and their dads and their brothers and their sisters and their grandmas and their grandpas. And the vast majority of the 80,000 deaths have actually been in nursing homes. Where on the other hand, most people don't actually know nursing home workers is not that enormous of an industry, but it is not a high wage industry. Surprise. In fact, the super majority of nursing home residents, what we would call patients often on the outside, our family members who go to nursing homes, well, they are funded. Sorry about that. That was a puppy breaking in. They are funded by Medicaid. And Medicaid is just the government program that you and I all pay taxes into, that there's a promise at the end of our lives that says that, hey, if we're alone, we don't have a lot of resources. The government's going to step in and help and make sure you're not homeless. You have the safety and security you need, as well as the medical care, to be totally frank. So it has been, I have never, let me put this way. The feeling of working during this environment reminds me of working during two different tragedies. The first was the Boston bombing from several years ago. I think that was 2015, where we were actually in contract negotiations at one of the hotels where the bomb exploded. We had, such a crisis. And then actually all the way back to 2001, when we had, I was involved with a union that had many members who died in the Twin Towers, particularly at the Windows of the World restaurant, where the entire restaurant obviously was eliminated and all of the members. And I remember back in those two tragedies, there were folks who came in and I was like, I don't know how to talk to people who are experiencing this level of loss and pain. And a mentor of mine said, well, the first step is to show up. And the second step is to listen. And the rest of it is about human connection. And so in the midst of extraordinarily challenging moment where people who are making anywhere from 10 to 15 bucks an hour are having to decide every day, am I going to put myself and my family at risk, same time as serve, our elderly, are having to make that decision, I'm there with them, helping them make that decision, helping them figure out how to improve their lives, how to improve their contracts. So I'll stop there. You can ask me all the questions you like.
Well, I think a lot of folks down here, like yourself, have loved ones in nursing homes or assisted living facilities right now. I'm wondering, if you have any tips for those of us in that situation. What can we do to protect our loved ones?
Sure. Well, I would say you've got there's a bunch of work that people can do at different stages of where their family members. So I'll talk about how do you protect our families first, right? So the very first thing to realize is that if you have a loved one that is getting older or is categorized as intellectually developmentally disabled, IDD, or has some other issue where they need ongoing help, there's a program in most states at this point, including Florida, to get what's called a home care worker. So that's step one, is knowing that I would say at this point, if a family doesn't have to make the decision to institutionalize a family member, to send them to a facility, you may want to keep them at home. A lot of people don't know that this option is even there. And for many Floridians, the program is actually free. It's not 24-hour care, but it could be up to 6 to 8 hours a day. And they'll do everything from administer medicine, to help with bathing, to actually help cleaning the house, to take a loved one out to Publix and make sure that they're safe at the supermarket. So I'd say that's certainly the preferable option, because at this point, and I haven't looked at this data in the last, let's say, 5 days or so, but the last time I checked, every single nursing home that accepts Medicaid, right, the free federal funding, there are COVID infections in Florida. So just to speak for myself, I think it's once a week at this point, I get the phone call where my mother, who is up in Delray Beach at the nursing home, where I get the phone call that she's either tested positive or negative. And I would say roughly every 3 weeks. Uh-oh. Hello?
I'm here. Can you hear me?
Is the live stream still working?
It is still working.
Great. I got an error message. Let's continue.
Technology.
Thank you, internet gods. I appreciate that little glitch into the universe. So just to say the reality of having a loved one in a nursing home will mean right now and for the foreseeable future, they will be regularly exposed to COVID. The positive side of things is that there is a heck of a lot more known about the virus. There's a heck of a lot more um, PPE, protective personal equipment, masks, gowns. Um, Nursing home workers kind of look like they're on the moon right now. I'll give you the routine. It's usually booties, gloves, um, obviously some clothing. Then they do a regular old face mask that you and I buy. If they have an N95, that goes on top, although most nursing home workers do not have N95 masks. There's still a national shortage, so they do a second mask. Then often they'll do a third mask. Then they will put on a face shield, and then they'll put on this whole bodysuit where it feels like you're in like a science fiction movie. And so just to take a pause for a second, how would you feel if you woke up in the morning, someone's coming to grab you some coffee and breakfast, and it's actually like a person in a spacesuit that walks through your bedroom? Now, could you imagine that causing increased anxiety, for example? So that's a lot of what's going on. I've talked a lot, but the other, we're getting the tips and tricks. I actually haven't provided you any tips. I've just been describing the situation. So let's talk about some tips. Tip number one that most people don't know is that on Medicare.gov, if you just Google Medicare rating nursing home, there is a national rating standard. There's a website that goes through every facility in the country and gives them a score from basically A to F. Check the score, right? It's like you wouldn't go on Amazon right now and buy socks if they had a low rating. But most people don't check the rating on nursing homes because they don't even know that they have a choice. And that's the second thing to know, is that this is mostly a for-profit business. And so often the way that an individual ends up in a nursing home seems like chance which one they're going to pick, but somewhere behind the scenes, someone's making money off that decision. One example would be is hospitals often get referral fees. So if you go to the hospital, recently, maybe 6 months ago, my grandmother fell and she broke her hip, the classic injury in Florida. So she goes to the same hospital, or she goes to a hospital, and the hospital discharges her to a nursing home for rehab. Well, I didn't want her to go there. I'm like, well, how did she even end up there? Oh, it turns out that there's an agreement back and forth where there's a fee per service. Every nursing home resident that goes in this nursing home, the hospital gets a bit of cash. So, this is the reality of also a for-profit healthcare system.
Yeah. I just want to interject. We had a comment from Shai, who's our executive director here at Temple Bethel, and he said, my mother was positive in a nursing home, but after she was moved to a new facility, and it's been amazing. So that's, wonderful when it does work out that way.
Yes.
But, I think for other folks, they're in a facility where they don't necessarily feel like they're trusting all that's happening and they're not able to see everything that's happening. So how can folks be best informed about the care for what should they be doing proactively to know what's happening with their loved one?
Sure.
And by the way, and anyone who has a question for Evan, please write in the comments here and I'd be happy to relate to him.
I would love to answer all of the questions. So a few recommendations. How do you actually stay in touch with what is going on? It is an enormous challenge. So some other tips to consider. If your family member has a cell phone, like many members have a cell phone, write down their passwords. I didn't do this. So the same level of security that Apple takes to national security incidents events of mass terrorism also turns out is remembering my mom's cell phone password. And so it's been 6 months. We haven't figured it out, unless I'm going to declare some NSA hackers. Just as a short aside, you have to show up in person at an Apple store, except in the state of Oregon, all Apple stores are closed. So what it means is my mother doesn't have a phone. And I tell this story because most people don't realize when you have a family member go to a nursing home, they don't usually have a voicemail. They can't get text messages. It's usually you call a nurse's desk that goes to another nurse's desk that just missed your loved one because she got up to eat dinner, you know? So the other thing is there is special vocabulary in nursing homes that actually gives us power. Asking for a care plan meeting. You know, I wish I had the more you know star that went over my head from reading Rainbow. Um, so that's a special meeting that's required by law, in which you are allowed as a loved one to join. You should go to it, because I'll just tell you right now, we are in COVID land, which means everything is delayed, everything is stressful, balls are dropped. But in order to, I skipped over one major thing as well, which is that if if you don't have power of attorney over a loved one, it's really hard to deal with any of this stuff. Um, and so another hot tip in Florida is if you don't have a power of attorney form for your family members, even if they are, 100% right now, you should work on that. It's, I believe you can do it yourself online for $30 in the state of Florida. It's one of the few states in the country you can do it online. You can hire a lawyer. It's usually like 124 bucks. But the key thing to that is if you don't have power of attorney, you don't have say over what happens with your family member's care. The other thing you don't have say is what happens to their Social Security, because someone's going to have to decide who's paying for all of this. And to just, have a heads up, and unless you're one of the less than 1% of Americans that have elder care insurance or long-term care insurance, a nursing home is going to cost $10,000 a month, maybe more. And I know most folks, according to a national survey, less than 50% of Americans have $500 in their savings account to get them through the next month. So, planning for that helps.
Absolutely. So, you talked a little bit about if, if you have the option, home care right now might be the best thing to do. For some folks, obviously that's not an option. So when I'm picking out the right facility, what are things I should take into account?
Sure. So I would start with going to the Medicare.gov nursing home rating website. I don't remember the name of the URL, but all you do is nursing home compare, or Medicare nursing home comparisons. And there is a survey process. It's an inspection where theoretically the government's supposed to be inspecting roughly every nursing home in some period of time. I suspect those surveys are over 9 to 15 months old at this point, because the whole system has broken down. But it's the place to start. It's definitely the place to start. The other thing I would do, if you are a little bit internet savvy, and I can't believe I'm saying this because information from social media is not trustworthy, is I would actually check social media. I would go on Facebook, if you have Instagram or a family member that has it, type in the name of the home. And here's one of the things I have noticed. People who work in nursing homes are incredible human beings. Nobody does this work for $12 an hour for the money. They do it because they have enormous hearts and they care. And often in my union organizing work, my job is to recruit those individuals as leaders of their organization so they can make change in the nursing home industry. Well, one of the things I look for is, what's the work environment like? And I'll tell you, if you go on social media right now and you type in the name of a nursing home, you'll often see either wacky videos where, because the stress is just so much, nursing home workers are putting on all of their gear and doing plays and musicals and sing-alongs and celebrations when folks get out of the facility, if they're able to get out. On the other hand, there was no system beforehand of accountability, and there is no system right now for abuses. The whole system's really broken down. And so employees have often gone to social media to just blow the alarm or honk the alarm. How do we press an alarm? We can
The
honk an alarm.
whistle, I don't
Pull an
know.
alarm. We blow a whistle. Various forms of alarm have been communicated via the internet, along with, here's the last thing, there have been strikes and picket lines and work stoppages about safety for the coronavirus. And the problem with all of us is we're in this memory hole where it is genuinely difficult for me to remember what happened in the world a week ago, let alone 3 months ago. But in the last few months, we've actually seen multiple statewide strikes or near strikes, mostly in the Midwest, but also on the West Coast, over COVID, for the fact that nursing home employees and hospital employees have been unable to get the protection that they need, right? It's like sending a firefighter in without an axe or water, and they still have to decide, do I go in to save someone? I have a feeling if firefighters were showing up to buildings that were burning and they didn't have water, we'd care more and there'd be more national outrage. But because it's seniors who are mostly dying or getting sick by themselves with a low wage, also of color workforce that has less of a voice in what's going on in the world, we don't.
So how can I help to give these essential workers a voice, when there isn't another platform? What can I do?
Well, are we allowed to talk about politics here? Can I share my unique political opinion?
I'm not going to stop you.
All right. Well, so here's the problem. The problem is that I'm going to not start with politics. I'll start with the facts. So the fact of the matter is there is no national approach to the coronavirus. There's no national approach to the nursing home industry. And that is the plan per our current president. He has said each state should do their best and come up with a plan that works for them. It's a federalist or state rights argument. Well, the problem is that the state of Florida is not going to be producing ventilators. The state of Florida, to my knowledge, does not have a latex factory. In fact, there's only one factory in America that makes latex gloves at this point, and it's in New Hampshire. They just got millions of dollars in funding to expand. Problematically, they won't be expanded until 2020, the end of 2021, beginning 2022. So a states' rights approach is really challenging in this moment. And, the other thing I have to say is that I would look to the current administration, except they literally have no policy platform for the next 4 years. And so then where you gotta look? Well, the other guy that's running, Biden and Kamala, they have what they call their care economy plan. And I think what is interesting about that to pay attention to, not like any of us can actually pay attention to details right now, is what they have proposed is a massive federal program similar to like the WPA Workforce Administration program back in the 30s to massively expand the care economy. So I heard from a spy that you have kids, Rachel. Is this true?
This is a fact, yes.
This is okay, great. I assume many of your congregation members have families. So, for example, in the care economy plan under the Biden administration, they've proposed effectively free childcare. There's very different ways to get there. One is a $16,000 tax credit. So you could pay up to $16,000 a year for childcare. I still don't think that gets you that far because childcare is really expensive. But they've also talked about opening up centers that are basically free that people can bring their kids to. The reason why I bring it up for nursing home workers and the reason why it's relevant is that they have proposed a massive testing program with standards. There is no national testing of nursing home workers at the state or of residents. They've also discussed there are currently 880,000 Americans who are on the wait list to get a home care worker. So in this moment, if you have a family member, you can have a totally able-bodied mom or dad who's in their late 60s, falls, breaks their hip, needs to do rehab, and yet they can't live in their apartment because they have stairs, not an elevator, where there's 880,000 of those individuals who are waiting for a home care worker. There's a backlog. And so Biden's proposed clearing the backlog by closing some tax loopholes and putting a ton of money into that. So that is a bunch of the problem. It is hard for us to have agency over this as individual people at individual nursing homes. It's a collective problem. And, it's funny, I start talking about politics and we're like, oh God, politics. But politics in this basic function is supposed to be a mechanism by which people come together to fix problems that they cannot achieve alone. It is not supposed to be a dirty word. It is supposed to be community building, just as, I assume what you're doing at the temple was. So there is a reason why we have to turn to politics, which is that it is a collective problem that each one of us cannot deal with alone. So yeah.
Speaking of our community, we did have some more comments from folks. Cherise says, invaluable information being shared here today. And Sharon says, my husband is in a private memory care center. The staff is wonderful, but the administration cut back on staff and resident COVID testing. At the same time, they started allowing family visits again after 7 months, which seems counterintuitive. They say they're following state guidelines. Anything we can do?
Sure. So the fun thing is, because I'm not a lawyer, I don't have to have any disclaimers. So these are all my personal opinions. So I'll go back to some definitions. First, one of the commenters talked about a residential care facility. So there is this nebulous world of what are called CBCs, community-based care organizations. Well, what does that mean? That's a great question. I don't know. In fact, no one really knows. Because it turns out that residential care facilities or memory care facilities, sometimes they're called assisted living facilities, are a completely unregulated aspect of the long-term care industry. There are basically no rules. I am not kidding you that if you had a relatively large house, let's say 5 bedrooms, and you wanted to get into the industry, and you wanted to start accepting people, there's not many hoops you have to jump through to just open one. It's totally different from a nursing home. So with that being said, I do not believe there's any national ratings. There's no national surveys. It's really a black hole. So I would say the number one thing is to stay close to your family member. The number 2 thing is to make sure that there is a care plan meeting that is happening that you can attend. And by the way, if it's happening at a time that you're at work, say no. This can't happen when I'm at work, right? The other thing I think you want to do, and this goes back to a general tip for everyone, something my grandmother did, which was very helpful, is one day she got together all the cards: driver's license, the Medicaid card, the Social Security card, the Petco card, the Publix card, and she put them all on a photocopier, and she just photocopied everything. And so, unfortunately, when my grandmother passed away and my mother nearly died, I got into their apartment and I found the special box that had all of the photocopies of all of the important cards. And the reason why that's important is if you want to make a complaint to a state agency in Florida over an issue that's happening, you need all of that information: their social security number, their driver's license, all the stuff you wouldn't think about. But I just also want to say, I wouldn't advise making a complaint right now. And the reason why is in my 6 months of now personally dealing with the state and working with a very good nursing home administrator, we have been unable to get a human being on the phone from the state of Florida that oversees nursing homes. We've both waited on hold for over 7 hours. And I had an employee email me kind of in secret to say, hey, we're not supposed to tell people, but we're not picking up the phone because we're so short-staffed that we don't have the capacity to deal with any of this stuff. So it is a really big challenge. And that's why I say, go back to being in as tight communication with your loved one as possible.
Got it. So I'm curious, is there a best means of being in communication with the aides or the, folks that are taking care of your loved one if your loved one is not in a capacity to be in contact with you?
Not really. So one of the things I would recommend is, if you have the means to do it, get your family member a cell phone, make sure you know their password. The other thing you can do is, I could imagine, I'm not sure I would even be comfortable right now visiting a nursing home, even though you're allowed to in the state of Florida, because there is COVID in every single building. And personally, I live with someone who's immunocompromised, and so I can't bring that back into the house. But most facilities at this point have a computer that is for the group. And so you can actually ask the staff to set up a FaceTime. Because sometimes when 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 folks aren't able to verbally communicate, they can communicate a lot with their actions and body posture and eyeballs. The last thing is, you always have the right to speak to uh, a nurse on duty, or the facility administrator. The facility administrator is sort of like the CEO of the building. And they actually have a phone number. You can talk to them. You can become difficult for them. That is totally possible. Um, the other thing I advise is that if folks are unhappy with the care that they're getting, first of all, if they're paying for it, stop paying. It's amazing when a nursing home misses a bill, or RCF, a residential care facility, misses a bill, they'll call you the next day. It might take 5 days for a doctor's appointment. And it is against the law for them to automatically evict someone. Now, I would not pay the bill for 90 days and not check on your loved one. But a day, sure, that will get their attention. And that's real hardball, right? But that means you're not getting communication. And lastly, you always have the right to remove them. So just because, I'll speak in my family's instance, my mother doesn't really have any assets, right? She doesn't have any money. She's an older woman who's used up all of her funds. So she gets free nursing home care through the government. If tomorrow I was unhappy with where she's at, I could fight to have her transferred to another facility. I guarantee they are not going to make me that offer, but I know that's my right.
Right. Okay. Well, there's so much to take into account right now.
There's a lot to take into account.
Yeah, I'm curious, because you also work with, employees in other sectors.
Yep.
What your take is, for folks who are not necessarily in nursing homes, but
sure,
in other sectors, and what they're dealing with right now that maybe we don't know about.
Yeah, it's wild times. I'm still shocked, and I realize I probably shouldn't be interviewing you, Rachel, so I'll try and make these statements and not questions. But personally, I am shocked that we've gotten through 6 months of the worst economic crisis in our lives, and we got a $1,200 check from the government. And some folks got some additional unemployment. Like, that is bananas. Besides just like the direct impact that's happening on people for not having money, what a lot of folks don't see as well is that states are running out of money. So the state of Florida is running out of money. The state of Oregon, where I live, is running out of money, running big deficits. And unlike the federal government, and frankly, unlike my personal finances, the state actually has to balance their books every year. They can't run a deficit. So if there's less money, there's less services. Most states have prevented huge layoffs right now, but everyone's kind of just waiting to see what happens with this election. Both presidential election, but also what happens in the House and the Senate. Because at the end of the day, Congress needs to pass a bill to support states who are running out of money. The states are running out of money, not because they were just burning cash. It's because there were a lot of obligations, right? For example, You don't build a highway in 6 months. You work on a 5 years, right? That's federal and state money going into it. So that's kind of a broad view. I think from a union perspective, and I can talk about this forever, so please cut me off when you want to. It's pretty outrageous. Essential workers have gotten shafted. Like, there is no national program to support essential workers, whether that's the grocery workers who are low wage and have to show up at Publix no matter what on day one of the crisis, right? To cops or firefighters or hospital workers. There are government employees. So I do a lot of work in the foster care system in Oregon, along with what used to be called the welfare department. All those folks had to show up to work too, right? But the other part of that is there has been more just sort of activism amongst workers in the last, going past the coronavirus. So let's say the last year and a half to 2 years, then there have been, I don't know, probably in the last 15 years, 15 to 20 years minimum. So there have been strikes, which I never really thought I'd see again in my lifetime. I don't know if you all remember, but there were a wave of teacher strikes that happened last year in deep red states, like Nevada and West Virginia and Chicago and Los Angeles. There was a big teacher strike. And part of what's going on is that people are just pushed up against a wall, right? Real wages have not increased in over, literally, I'm 39 years old and they haven't increased since like 1979. And I was born in 81. So in my lifetime, real wages have not increased, meaning that things have gotten more expensive no matter how much more money we all make. My guess is there are people out there who have that similar experience, which is like you're working. Somehow things just get more expensive. Hey, it's not on you. Turns out it's a national dynamic. Again, things that we're supposed to deal with collectively because we can't deal with them alone, but our political system is broken. I'm really excited about the amount of activism and leadership that's coming out of our membership specifically. We, at the start of the pandemic, this is kind of embarrassing, but for 4,400 nursing home workers, I think we had 33 or 36 leaders, people who said, hey, I want to do a ton. I'm going to run for office within my organization. I am going to sit in meetings to negotiate contracts. So we've gone from 33 or 36 to somewhere around 200. And it's been like that. And it's because this crisis has really called the question on individuals of, well, who's got my back? What power do I have to change my reality? And most people, unfortunately, have very little agency in their lives. Most people cannot control where they work. But when you have a union, you actually have the right to not control where you work, but at a minimum, you have the right to sit at the same table with the people making the decisions and say, I want things to be decided differently. So that's what's exciting. And that's what I find optimistic.
Cool. I love that. Do you feel like unions in Florida are, flourishing or working in favor of the members of those unions?
Yeah.
Or not?
So I'm not an expert on all unions, but I can speak to what I know, which is what I do. And so there's a very large nursing home and hospital workers union that runs up and down the West Coast. It's sort of my sister organization. I would say they're in war mode because, let's just be clear, this is a for-profit industry. And so to explain the employer side of thing, the industry side of thing, a report came out last week that said most nursing homes are operating at a profit margin of 3%, and they expect to potentially run out of money within 6 months. It's just interesting, right? Because in other countries, if you're in Europe, there is really not a for-profit nursing home or healthcare industry in the same way there is here. There are services, but I'm sort of like, I don't really care about the profit margin of these companies. I mean, maybe I should. I want them to be profitable. I want everyone to make some money. But there were a lot of people a lot of companies that were making less than 3% profit margin before COVID. And so I think what's going on is they're used to making like 8% or 11% or 15% profit margin. That's part of what I've seen. I have been part of a number of national meetings, but over Zoom, with nursing home workers from Florida. And it is a very different tale than what I'm experiencing. Frankly, there's a really high level of death within the membership. And so it's been a lot of sitting and listening and supporting individuals as they go through the grief that they're going through. But the other really just enormous challenge is there's no consolidation in the industry. There's lots of mom and pop shops and there's regional companies, but it makes fixing the problem so difficult because it means that it might be interesting to talk about like what I actually do for a living. But part of what I do is I literally bring people to a table. Now I do it over Zoom. And I talk to the decision makers who own the companies to say, hey, here are the problems that we need to resolve. Well, there's only so many of those conversations you can have. And if you have hundreds of different employers, you'll never get to all of them. You just won't, right? And so there needs to be some national approaches to this stuff, or at least statewide approaches to this stuff. California has started to think about how do we just deal with resident safety and standards at a statewide level. So you don't have to go home by home or company or chain by chain, but it's really in the very beginning days.
Got it. So theoretically, if we wanted some kind of a statewide standard in Florida for nursing home facilities, we could send a letter to our governor?
That's a great question. I think the most effective people to talk to right now, well, to be honest, no one's paying attention today because there's this other thing happening today. Turns out a bunch of them are reapplying for their jobs and we're going to decide whether or not they should keep them. So with that being said, your local House and Senate representatives, particularly your House representatives, are really useful. Nobody knows who these people are. I don't even know who the person is for me in Oregon, and that's embarrassing. But they are more responsible to constituent services. And while you ain't going to get national standards, you will have someone pay attention to a local facility if there are problems. And I think that's where we're at. Like our locus of control, what we can engage with in a way that actually is empowering and not disempowering is figuring out how we can make change in our immediate environment. So that's both like, talking to your family member that's in there, asking your friends' family members if they're okay, talking to your local representative. I think that's probably the best way to go. Yeah.
Great. Well, so to that end, I do want to remind everyone that it is November 3rd. I want to wish my parents a very happy anniversary today.
Happy anniversary. Oh, apparently other people are watching this. It's not just me. Okay.
And also, get out there and vote if you want to have a say in, what our representatives are doing for our loved ones and for ourselves and for our neighbors. Thank you, Evan, so much for being here. Sharon also thanks you and appreciates the good advice. Shai also says that his mother was getting excellent care at Purdue. This was really informative. Evan, if folks have more questions, where can we, direct those questions?
Where you find me? Yeah, sure. Well, you can find me on Facebook, Evan Pastor. My email, really simple, because I'm an elder millennial when Google came out. It's evan.pastor@gmail.com. So those are probably the two ways. And if folks have questions about the nursing home industry, their family members, if they want to start a union, if they have random questions about the world, I'm happy to answer them.
You're amazing. I love you. Thank you so much for being here. And thanks everybody for joining us today. Evan, I'm going to ask you to take us off live streaming because you've helped us with that today.
And here we go, everyone.